If you suffer from varicose veins, then you probably know how painful and unsightly they can really be. But there's help, and lucky for us, Dr. Edward Mackay is back to explain what this problem is and how it actually can be more than just cosmetic. Doctor, welcome back. How are you?
I'm fine. Thank you for having me again.
Well, we are excited because, again, this problem, as I'm learning, is very common, and it's more than just the unsightly look of veins.
Right.
There's a lot of symptoms that go with it that actually can be harmful to people's health, right?
Oh yeah, well, it can really adversely affect their daily life as far as the way they're functioning. The veins, when the valves have failed and you have varicose veins, it can lead to leg swelling, and it makes your legs feel like you have weights around their ankles when the ankles swell. And so it can really bother people significantly. And if it's allowed to go on, then it leads to skin damage and even venous ulcers on the legs that are very difficult to deal with.
So when should a person maybe, pick up the phone and give you a call? Is there a certain point, or if they just notice them, what do you recommend for people as a good time to seek treatment?
Well, it's based largely on symptoms. I mean, first of all, your insurance, a lot of people are concerned about what their insurance will pay. Well, the insurance is going to pay it when you have problems, that not just the presence of varicose veins that you don't like the look of, but actual problems such as pain or the swelling that I mentioned, which is the big one. Because once you start getting swelling, then you're going to start heading into start getting the skin damage if you allow that to go on. And you've probably seen those people with the discoloration around the ankles, and that's when the skin has been damaged. So it's important that they know that the insurance company anyways want to know that you have symptoms, so that when you get treatment, you're not just doing it for cosmetic reasons.
Well, I was saying, I'm glad you're talking about specifics, because we actually do have some before and afters that we want to get to. If you want to kind of tell us what we're seeing in these and what you've been able to do for these patients, for instance.
Right. Well, this is very typical people who have varicose veins on the inside of their legs. It usually comes from what's called the saphenous vein. The valves have failed, blood's flowing backwards, and it causes pressure to build in those veins. And the first sign of that is the bulgy veins. But that vein that's bulging frequently causes discomfort, and that's one of the first complaints is pain from it. And if it starts to bother them enough, they probably need to have it looked at and treated. And these are kind of things you can do in the office, local anesthesia. You go, immediately leave and go back to your normal activities that day. There's really no downtime. And so someone like this had their saphenous vein treated with one of these endovenous catheter treatments. We either use the RF closure device or the laser, and there's new devices coming out all the time that with either the cyanoacrylate glue or the mechanical chemical ablation called Clarivein, or even a new foamy solution that's like shaving cream that you can inject into it that can damage it. And again, a lot depends on what the person's insurance will allow us to do, and we have to kind of work with them and figure out what they'll allow us to do. But most of the time we can get it covered, and it's done in the office, and they go home the same day and do their normal activities.
Now, you spoke before about how technology has changed the way you treat these kind of situations. Yes. And with that said, I'm assuming, we've talked about the treatments, the downtime probably has decreased as well, correct? Oh,
it's been dramatic. Used to be, when I first started vascular surgery 20 years ago, we were doing strippings, and you'd go in the hospital, outpatient, or maybe one day in the hospital, and they were wrapped up for days, and it took a couple weeks to recover. Now we're doing it in the office, straight local anesthesia. Maybe some people need a little sedation to help them along, but most people don't, and then they get off and go about their normal activities immediately afterwards.
Okay, well, he's got the experience, he's got the technology. Dr. Mackay here has got you covered. If you are interested in getting more information on his practice, there's the website and, of course, the phone number, 727-527-2888. And 3 locations these days.
Yes, we're running around. I have some help.
I have 1 or 2 people, right? I'm
yes.
assuming. Well, thank you again for your time. We do appreciate it.
Thank you.